Today I would like to talk about one of our best-selling speculums, the EasySpec. With me today I have Malin. She is a professional midwife. And I'm very glad to have you here, Malin.
Thank you.
First I would like to talk about our very nice and smooth rounded edges of the speculum, both in the handle and on the beak here for the comfort of the patient. Would you like to say some more about that, Malin?
Yeah, as you said, the name is EasySpec,
Yeah.
and I think it's a speculum, two-part speculum that is quite easy to use, and it's exactly as you said, this round form here and the low friction surface. It makes it the best comfort possible for the patient.
Good, and then we also have one thing that's a benefit in our speculum is the very wide opening we have on it, and it's so it should be easy for the examiner to use a tool or whatever they're going to do during the examination. And when you talk, we have the different sizes, but the opening is very big. It goes down quite far down on the lower beak, so you can see the whole area when you do the examination. One thing we have in our speculums as well is the breaking points. From the small to the large, there is a breaking point on the upper beak outside the patient. This is for patient safety. If for any reason there would be too much force when you try to open the speculum, and I think this is a benefit because many competitors who talk about their unbreakable speculums, but I think it's very important to have a breaking point on them if unnecessary force is used during an examination. It should break outside the patient. Do you have anything to add on that, Malin?
No, it feels secure to use it by that point.
Yeah.
By this breaking.
Good, and then you mentioned that when it comes to closing the device before you take that out, you help us about the pinching of the walls.
Yeah, you have to be careful, of course. You have here, and then I usually lock the device. I close the device and I turn it a bit and then take it out. Then if you take it out slowly, you have less risk to pinch the vaginal walls.
And one thing we also like very much with our device is the locking key we have. Many of our competitors, they have like a flat surface on their locking key. One thing we have is 12 different locking stages, which I think is a great benefit, and we've had some very good customer feedback from our clients in Sweden especially on this. And what would you say about this 12 locking?
It makes it quite flexible to use. So, and you have, this is like when you have the most open part, and maybe, and this is when it's closed. So you can always find, it's very easy to find a position that is suitable for the patient you got.
Yeah, one thing we tend to find when you don't have this locking, this fast locking keys, is that when the key is flat, it tends to close. It tends to close when you try and lock it, but here it's fixed, so you can't. Literally, you would break the speculum if you try and force it to close. They also have the handle is very smooth to hold, and we have some rigid grip surface here on the handle, so the examiner shouldn't slip while you hold it.
We're lucky because we have 5 different sizes, so we can find a size that is suitable for the unique patient. We have it comes in medium, small, extra small, large, and extra large.
Do you think the sizes cover all the different patients that needs to be examined?
Yeah, I think so. We started with the devices in medium, small and large, and the complement now is the extra small device that is covers for maybe the elderly with dry mucus, vaginal tissue, and so it could be suitable for them. And we also have the extra large that is quite long but also a bit wider, so it could easily help holding up the vaginal walls a bit easier. So I think, yeah, I would say for this EasySpec, the 5 sizes, it will cover 99% of your needs when you use a device like that.
Good, and we'd also like to add that we have different colors for the different sizes.